Okay, this video is a rational treatment approach to autoimmune disease. So where this comes from is some of my internal medicine doctor friends tell me they've got autoimmune patients and they're really not doing so well. And I've also had some doctors approach me to talk to me about their autoimmune disease. And basically, I'm going to explain to you how to think about it in an intelligent way and to treat it in an intelligent way with minimal risk. Sometimes you have to take more risk, but if you can cure a disease easily, why take all that risk? I'm also going to tell you I think conventional medical approach to autoimmune disease is completely stupid. If you want to go down that path, then please go away. Don't waste my time and have fun being sick. So let's talk about it. First of all, Dr. John McDougall. He says if you want to cure a disease, you've got to avoid the cause. If you go to Dr. John McDougall's site, you'll see page after page of patient cured from autoimmune disease by eating the McDougall diet, which is basically just a low-fat vegan diet with no oil, okay? And you should go to his website and look through these testimonials because they will increase your hope and your motivation. And you'll develop like a growth mindset, the Carol Dweck growth mindset. Once you realize it is possible to get better, to dramatically improve, then you'll be motivated to do what's necessary. Okay, leaky gut and leaky gums. That's the number one cause of autoimmune disease. So you want to take good care of your mouth. And taking good care of your mouth doesn't mean being an idiot and using fluoride toothpaste. It means avoiding foods that cause cavity, cleaning your teeth. I've given other lectures on this. So all these things here too, I'm not going to go into every last detail. We don't have time to do that. But I'm alerting you to what matters. So you can check my lectures on toothpaste. You can check, by the way, I don't use any fluoridated toothpaste. I never would. You can check my lectures on what's in toothpaste, how to take care of teeth, how to protect your teeth. Okay, so most common cause of autoimmune disease is leaky gut, whereby big chunks of animal protein get across the gut barrier and they activate something called molecular mimicry, whereby they're different enough that the immune system recognizes them, forms antibodies to them, but they're similar enough that those autoantibodies will cross-react with our own body tissue. So that's called molecular mimicry with autoantibody cross-reactivity, and that's the main mechanism of autoimmune disease. There's a lot of other ones, though. So just by fixing leaky gut, eating your dietary fiber and avoiding the things that cause leaky gut, lots of people get better. Many are 100% cured. Okay. Excessive dietary fat will activate neutrophils and cause systemic inflammation. They'll release myeloperoxidase. It damages the endothelial glycocalyx of the blood vessels, causes inflammation, systemic. Okay, I'll show you pictures of that in just a little bit. Leaky gut, you'll get bacterial endotoxins getting across the gut barrier, like LPS from gram-negative bacteria, LTA from gram-positive bacteria. You get amyloid clotting, tissue injury. You get like microvascular angina, for example, syndrome X. You'll plug up vessels all over the place. That can also cause cognitive decline. You don't want that. Amyloid clotting, I'll explain that a little bit later with the pictures. I've given lectures before on all these things. Leaky gut associated with lack of fiber. That's a problem. Like Jeff Nelson has a great quote. He says, fiber is life, pharma is death. Okay, so what he basically means is eat your fiber. Don't focus on taking drugs unless as a last option. Okay, lack of short-chain fatty acids. When you eat dietary fiber, the good bacteria make short-chain fatty acids, and those are used to maintain the tight junctions, and that keeps you healthy. If you don't eat the fiber or you do other things that damage the gut lining and the gut bacteria, then you get a leaky gut barrier, and simultaneously, because you don't produce the short-chain fatty acids, in particular the butyrate, you'll have a leaky blood-brain barrier. And you can even get LPS and LTA endotoxins entering the brain periphery, activating the microglia, the brain sensory guard cells, and that will cause neuroinflammation, and that'll lead to brain fog, and eventually, decades of that will lead to cognitive decline. Okay, the next thing is iron overload. Average Western person, men are iron overloaded in their 20s. Women are overloaded, by about 60 once they're postmenopausal and they stop menstruating. That leads to ferrous redox cycling, amyloid clotting, and then that'll increase reactive oxygen species oxidative stress. By the way, I know this first slide is kind of difficult. I'm going to show pictures of all this, and I've given lectures of all these things. The reason I'm making this first slide so complicated is I'm going to summarize everything because there's some people who've seen the other lectures and this will put it all together for them quickly. There's other people who are too lazy to watch the whole lecture, so I'm trying to give you the whole big picture in this first slide. But I am going to show a bunch of pictures following this. I got a bunch of slides for this talk to help you realize what your options are to try to improve your health. Okay, this is the advanced class. This is not, how to trick a pro. Okay, this is how to save a pro. Okay. Next thing is, so you want to avoid all these sources of excess iron. Next is omega-6 cooking oils. You don't ever want to eat fried food, okay? That's why all these people who eat an Indian diet are sick even though they look skinny when they're young, okay? You don't want to ever eat fried food. And meat will have a lot of arachidonic acid, another omega-6. You don't want excessive amounts of that. Don't be drinking alcohol. Alcohol's for chum. Wine, a cup of wine or beer a day is BS. You don't want to drink that stuff at all. Zero alcohol, okay? All these things lead to excessive lipid peroxidation, then toxic aldehydes, things like H&E, hydroxynonenal, and then you end up with DAMPs, damage-associated molecular patterns. You start damaging tissue and the immune system can react to it, and that can be a source of autoimmune disease. Okay, you want to avoid some well-known toxins that increase your risk of autoimmune disease. F- in the water, fluoride is bad. You get that out with a reverse osmosis filter in your kitchen, under the sink. You can put shower filters for F-. You can move somewhere where F- isn't in the water. Watch out for GP. Put on non-organic food like soy. That's glyphosate, glycine phosphate. I'll explain why that causes autoimmune disease. They both can distort collagen, and that can turn it into a DAMPs, damage-associated molecular pattern. Again, that means you damage a tissue and distort its shape. The immune system reads everything by braille. It feels everything. So if you distort the shape of a protein, you can get an autoimmune reaction to it. Meat also can lead to xenosylitis, foreign sialic acids. They're on the edge of the glycoproteins of the endothelial glycocalyx. And basically, the meat sialic acids are similar enough to normal human stuff that they get incorporated into our tissues, but they're different enough the immune system recognizes them and causes systemic inflammation. And what I'm really recommending here in this slide is a holistic approach to treatment, whereby make yourself as healthy as possible so your immune system works better, so it's not unnecessarily activated by DAMPs and other problems leading to tissue damage and symptoms. Okay, be as healthy as possible. I'm kind of showing you how to be as healthy as possible. And if you're a doctor listening to this, keep paying attention, because I'm going to tell you something. Your medical books are a joke. I've read your books cover to cover. I got 99% on my boards. You could know that book from cover to cover, and it's a joke. And also, I know the smartest doctors. I'm not going to say their names, but I know two guys, internal medicine doctors, both got IQs about 155, and I'm telling you, they're babies compared to me. They're Lilliputians. I'm a Gulliver, because they don't know nutrition, epidemiology, toxicology, and all the things that start with the letter S. You guys are taught drug-based medicine. You really don't know what you're talking about when you start getting into nutrition, epidemiology, and toxicology, and those are the most important subjects. Okay, so we'll continue. Other sources of DAMPs, damage-associated molecular patterns, besides xenosylitis. You can also get problems with things like implants. Breast implants can leak, cause breast implant illness, the silicone, for example. And there's other implants that can cause problems. Dental implants. That one guy, Gerald Curatola, he's got some good lectures on the internet about dental implants. Some joint implants can lead to reactions, or other metal surgical implants. All right, estrogenic chemicals can damage the immune system. Women get about 80% of autoimmune disease. Estrogen makes the immune system a little bit crazy, okay? A woman, carries a baby, pregnancy, and that's like having a, big foreign body in herself, okay? And in general, so the female immune system in general is a little more hyperactive compared to the male. That's why they tend to handle having the colds a little bit better and things like that. Okay, so what I'm basically saying is avoid exposing yourself to unnecessary estrogenic chemicals, and there's tons of them. I've given entire lectures on how to avoid them. Okay, excessive dietary salt. That can hyperactivate the immune system, cause asthma and other autoimmune diseases. It can cause other problems too. It can increase your risk of metastatic cancer. Okay, and I can tell you, like, for example, my brother was a fantastic athlete in high school, state champion, freestyle Greco-Roman wrestling, goes to college, and, he was still good, but he never reached his potential, okay? And everybody's like, well, why not? He just ran out of energy compared to, like, the University of Iowa guys in the third period, and because he had a form of exercise asthma. Nobody quite knew what it was all about. And then when he's gotten to his 40s, late 30s, early 40s, he became a vegetarian. He still eats some meat, but he became largely vegetarian. Stopped adding so much salt to it. Anyways, his exercise asthma went away, and now he's a world champion. Okay, he's a world champion. Okay, and what I'm trying to say is his energy came back. So you can get more energetic and fit and strong in your 40s if you improve your health and diet and you avoid bad foods, bad toxins. Okay, oxidative stress in general, we're going to come back to that. Other things can affect that: EMF, Wi-Fi, excessive dietary fat. So you really want to sort of like make a list of all the things you can improve and start improving them, and then watch your health improve. Watch out for advanced glycation end products. There are two main sources. One is externally from your food: meat, fried foods, overcooked foods, nuts. They're all bad. Okay, then there's the endogenous, ones produced in your body. And that's like when you have diabetes, you get hyperglycemia. That can lead to glycation of things like hemoglobin A1C, which actually can cause some tissue hypoxia. I'll get into that later. But the other thing it'll do is you'll then, when you inhibit electron transport in the inner mitochondrial membrane, the characteristic mechanism of saturated fat, dietary fat causing insulin resistance, you get a backup of Krebs cycle, you get a backup of glycolysis, in particular at glyceraldehyde 3-phosphate dehydrogenase. And you run side reactions off that like MGO, methyl glyoxyl, and that produces a lot of AGEs. So I've given an entire lecture on AGEs and diabetes. But just be aware that starts going all over the body, damaging tissue and creating a DAMPS-like situation that can lead to autoimmune disease. Okay. In addition, the enzyme in the blood, insulin-degrading enzyme, which removes insulin from the blood, has high affinity for insulin. It has lower affinity for beta-amyloid protein, BAP. BAP is beta-amyloid protein. And it's only produced in limited amounts, the insulin-degrading enzyme. So when you use up your insulin-degrading enzyme, clearing out the high levels of insulin because of insulin resistance, then their BAP starts to accumulate. And BAP, beta-amyloid protein, goes retrograde from the peripheral part of the body up into the brain, crosses the blood-brain barrier, and it causes brain damage. It binds to the NMDA receptor for glutamate. It's a calcium channel, and it activates it. Okay, so that causes overstimulation in your brain cells. That in conjunction with other stimulants like caffeine and aspartame, and glyphosate, that can lead to brain fog, anxiety, insomnia, depression, cognitive decline. You're basically making yourself stupid. Okay, also when you have high hemoglobin A1C, you're going to get a decrease in SERCA, sarcoplasm, endoplasmic reticulum, calcium ATPase, which is basically pumping calcium from the cytoplasm of a neuron into the endoplasmic reticulum of the neuron to lower cytoplasmic calcium, which means stop overactivating that neuron. Okay, I got entire lectures on excitotoxins, all this stuff, Rogers' supply and demand theory of cognitive decline, dementia, and all that. So I'm letting you know this. So what I'm basically talking about here is you want to be simple. You want to be like Adam and Eve, but keep your indoor heating and plumbing. Eat things our ancestors would have eaten hundreds of years ago. We're designed to eat plant foods. Like Genesis 1:29, God said, I've given you all these plant foods, okay? Eat them, be healthy. All right. So what can you do to get better? First of all, eat the low-fat, low-sodium, low-protein, 100% vegan diet, whole foods only, single-ingredient foods only, organic only, no oil, not one drop, no caffeine, no alcohol, none. No MJ, none of that crap. All right. And if you're still not better, you can try an elimination diet. Dr. McDougall has a good newsletter about elimination diet for preventing autoimmune problems and preventing all the gluten diseases, celiac disease, and all that. Also, I wanted to mention on here to avoid problems with SERCA, you want to avoid volatile organic chemicals. What that means is anything that smells bad is bad for you. Okay? God made your nose for a reason, and he's a lot smarter than you are. So if anything smells bad, that's a warning sign. It is bad for you. So what you should do is avoid things that smell bad. For example, do not burn candles in your house. That's freaking stupid. One of my relatives did that. And, they couldn't understand why I had all these pulmonary problems. No, get rid of the candles. You don't need to burn candles in your room. Okay, what else? Don't live near a factory. Do not go to the dry cleaner and smell that TCE, trichloroethylene. It's freaking toxic. Don't use liquid paper. It's toxic. Don't smell paint. Ventilate your place. Anything that rapidly changes from a liquid to solid gives off VOCs, volatile organic chemicals. So avoid it. Okay? Like let's say a bus drives me. I hold my breath as long as I can until it's far away, okay? If there's auto exhaust, I'll avoid that area. I always do whatever I can to avoid all that crap as best you can. Okay, so let's say you try all this stuff. You avoid everything that smells bad. You eat the perfect diet. You get your exercise. You get your sleep. You manage your stress. And you still got a problem. Then I would say it's reasonable to try the eat lots of omega-3s approach, the sort of the Brooke Goldner approach. But that's an immunosuppressant approach. See, I like my stuff better if it'll work, and it usually works according to all of Dr. McDougall's experience and a lot of other papers. But if it doesn't, and it doesn't sometimes, in elimination, you try that. Then I would try the Brooke Goldner approach, suppress the immune system. Okay, but do it through food, through eating all these omega-3s. And if that still don't work, then I would try conventional medicines. I don't like eating a lot of omega-3s because you eat a lot of omega-3 fats, you increase your risk of obesity, of insulin resistance. Immune suppression might increase your risk of significant infections, increases your risk of cancer, prostate cancer. Omega-3 supplements in excess are associated with increased risk of AFib. So I don't want to go down that path. But if I had to, I would try that path before I would try those drugs. Those drugs are almost like chemotherapy, man. Methotrexate and all this other stuff. But those are the conventional medicine immune suppression drugs that one could try. Okay, so that's the whole big rationale. I hope that's helpful to you. And now I'm going to start going into individual slides, explain things in more detail. Oops. So the first thing to get is you want to avoid Trojan horse situations where things are getting into your body that do not belong there. Here is the leaky gut slide. Basically, good gut means that good bacteria get the fiber. They make short-chain fatty acids, in particular butyrate, 4-carbon butyrate. It's kind of like butanoic acid. The gut lining cells, the enterocytes, make TJs, tight junctions, and that prevents bad things from getting into across your gut line and causing a problem. If they get locally into the gut wall, they'll cause gut inflammation, things like irritable bowel syndrome, Crohn's disease, ulcerative colitis. Okay, if they get then a little further, get into the blood, then they can cause additional problems. Now here's when you have a lack of leaky, tight junctions. Now you can get bacterial endotoxins like LPS, lipopolysaccharide from gram-negative bacteria. The analogous version is LTA from gram-positive bacteria, lipoteichoic acid. They can cause inflammation in your gut, they get into your blood, and they can start activating your immune system and causing autoimmune disease, causing blood clotting, amyloid blood clotting, and other problems. They can cause neuroinflammation of your brain. This is what I meant by big chunks of protein. Normally you can only digest monopeptide, dipeptide, tripeptide. That means 1, 2, or 3 amino acids at a time connected to each other. But when you got open tight junctions, you can absorb really big chunks of animal protein, and because it's animal protein and similar enough to your body's own proteins, it's foreign enough the immune system reacts to it, forms antibodies to it, but it's different enough that those antibodies, they can cross-react with things in your body and so they can cause autoimmune reactions. So what I meant is it's different enough the immune system reacts to it, but it's similar enough that those same antibodies can cross-react with your own body and damage your own tissue. Like that's thought to be the main mechanism of lots of autoimmune disease. For example, those thyroiditis type problems, Hashimoto's. Okay, here's a list of all the things that'll cause leaky gut. Antibiotics, things that kill gut bacteria like fluoride in your water and chlorine in your water. That's why you should filter your water. It's good to have a whole house carbon water filter and a kitchen reverse osmosis filter. And you might need an iron removal filter or water softener too if you're pulling well water, for example. Okay. Sat fat, bad for the gut lining. Oils are all toxic to the gut lining. Meat-based diet, meat and dairy are bad. Dairy also causes a lot of constipation. Glyphosate was even an antimicrobial. It's freaking toxic. You don't ever want to eat that crap. Herbicides. It's another reason why you want to eat organic. They lower your risk. Excessive psychological stress decreases blood flow to the gut, can cause leaky gut. Caffeine contributes to the problem because it raises the same hormones as excessive stress. Alcohol is toxic to your gut. Emulsifiers and processed food. You don't want to eat any processed food. It's all bad. Patients with diabetes, kidney failure, obesity have increased leaky gut. Carrageenan can have MSG in it. It can function like emulsifier, toxic to the gut lining. Some medicines, NSAID, aspirin, antacids can also be toxic. They can lead to problems with your gut bacteria, dysbiosis, getting bad gut bacteria. Even BPA and the old BPA plastics and BPA equivalents, and there's a lot of them. Some people are sensitive to gluten. You can get infections like yeast infection, candida, and especially like if you're on oral contraceptive pills. Artificial sweeteners can be toxic to the gut. I recommend you avoid all of them. All right, well, anyways, there's more of them there, and I've given entire lectures going through that in much more detail. So what I'm basically saying, my approach to healing is you want to try to be like Sir Galahad. All of King Arthur's knights wanted to find the Holy Grail, but only Sir Galahad could because he made himself worthy, okay? Lancelot was a better knight than Sir Galahad at fighting, but Lancelot was bonking Guinevere when he shouldn't have been, and his irresponsible behavior led to him being denied the ability to find the Holy Grail. Sir Galahad kept himself pure, did what was right, and he was worthy to find the Holy Grail. And by that I mean do what you're supposed to do. Because I talk to these doctors and they give me these attitudes like, oh, well, I'm not going to do that. I'm like, well, I don't give a rat's tail what you do. You're the one who is sick. You're the one who's calling me asking for advice. You want to get better. I told you what to do. And if you don't believe it, why don't you just try it for 4 weeks? Like I said, avoid certain foods, all animal foods, all oils, avoid powder foods. And they're like, well, I'm not going to do that. I'm like, well, that's fine. Well, we'll see if you get better. And they didn't get better. And I'm like, you half-ass it, and what do you expect? If an alcoholic tells you, well, I only drink on the weekends, would you say that's a successful sobriety? No, you say you're screwing up. Don't drink on the weekends. Don't ever drink one more drop. Okay, that's it. A smoker says, oh, I need a nicotine patch. I'd say stop being a wussy and quit, you wuss. You want to be sick? You want to burn up your lungs, destroy yourself? What is a way for you to do that? Your family's dependent on you. You're a jerk. You're a weasel. Okay. I'm not your mommy. I'm not going to give you unconditional love. I'm going to tell you the truth. You can take it or leave it. And if you're too stupid to do this, that's your problem. It's not mine. Okay. Next, I'm going to talk about how the typical patient thinks real fast here. They think, oh, I'm going to go to the hospital like it's a, religious pilgrimage to Canterbury, and the doctor is going to save me. And the harsh reality is you have to save yourself. Sometimes a doctor can save you. Sometimes the medical system can. But in the vast majority of situations, it's you who will determine how well you do. As my doctor friends like to say, the patients don't realize it, but they're the ones who have the power to make themselves better or worse. And then what I also said. I know the famous big shot doctors. I know the doctors people think are the smartest ones. And I'm telling you, compared to me, they're Lilliputians because they don't know nutrition, epidemiology, and toxicology. And it doesn't matter if you go to Harvard or any of the Ivy League places. They don't use nutrition, epidemiology, and toxicology. And therefore, they pretty much stink, and they're pretty much all the same. And that's the truth. Now, the typical patient rushes to the doctor and very quickly gets a bunch of medical tests. A tube down the throat, a tube up the butt, CAT scans, a whole bunch of autoantibody tests. And yeah, fine, you can do all that, but why not cure yourself first? Try to cure yourself first and then do that stuff if you don't get better. Okay, here's a typical example of what fluoride can do. It can substitute for hydrogens and distort the hydrogen bonding within a protein. And then when you disrupt these bonds, the protein folding is disrupted, and it now becomes a damage-associated molecular pattern, confuses the body, and you form an autoimmune reaction to it. And it can do that to collagen. Here's glyphosate, and it's really glycine phosphate. So glycine is the smallest amino acid. Amino acid has an amino group, and it has an acid group, carboxylic acid, okay? And then it always has at least one hydrogen on it, and then it has a side chain called the R group. Glycine is the smallest amino acid. Its side chain is only a hydrogen. And that's very useful. By being small, it can fit into enzyme active sites, leaving room for the substrate. It's also used in double helix, triple helix type proteins because you can wrap it tightly. Like, okay, we're going to talk about that, like collagen's a triple helix. So when you get glyphosate, you can think of it as being an added phosphate to glycine. It's a little more to it than that, but that's basically what it is. And the relevance is all of a sudden it's much bulkier and it has a charge on it. And that's not good for proteins or for enzyme active sites. This lady, Stephanie Seneff, she did a whole bunch of work on this. And so if you want to see her work, you can. Again, I got lectures on all this stuff. I'm just giving you the sort of like the highlights here. This is sort of, and this lecture is so that I know there's people out there that have autoimmune disease and they want to get better. And I'm telling them what I think will help them, okay? So I realize this lecture is a little bit advanced, it's going a little bit fast, but it's all sort of for people who know a little bit already. Okay, so here's the point. Normally got glycine in an enzyme active site. And now you substitute in the glycine phosphate that sort of sneaks in like a Trojan horse, like what I was talking about earlier, and it messes up the enzyme site. This big bulky phosphate in there with a negative charge on it, that's going to prevent the substrate from coming in. Now that enzyme's close to worthless, it's not going to function effectively, okay? So you see how substitution of an abnormal amino acid can distort a protein structure and make it non-functional. And now here's the problem. Collagen is about 1/3 of the proteins in our body. It forms our ligaments that hold everything together, scaffolding system of the human body. Every third amino acid on collagen is a glycine, and that enables it to wrap tightly into a triple helix. Well, if you start substituting glycine phosphates in there because you're eating non-organic food like GP sprayed soy, and you see non-organic, man, they'll spray oats, they'll spray beans, they'll spray a lot of stuff. That's why you don't want it, okay? You want organic. And who the heck knows what the GMO does? So anyways, there it is. You don't want GP. Eat only organic. Other things that mess up your collagen include ischemia, if you have ischemia of the spine from atherosclerosis, lack of vitamin C, a scurvy-like effect because you don't eat your fruits and veggies. If you're smoking, tobacco, drinking alcohol, ingesting caffeine, it's all bad. Advanced glycation end products from diabetes can screw things up too. There's rare congenital disorders, but they're so rare. Okay, I've been a doctor over 30 years. You know how many cases of Ehlers-Danlos I've seen? You know, like maybe 2 in 30 years, okay? Outside of a conference or something. Come on. Rare diseases are so rare, they're kind of irrelevant. Oh, here's a Spartan vegan diet, and it's real simple. So the Spartan vegan diet is my version of the low-fat vegan diet. Basically, I'm pretty much the same as Esselstyn and McDougall. McDougall says eat 90% of your calories from starches, 5% from fruits, 5% from veggies, and that will make you a lot healthier. And that's just do that right from the beginning, and you can figure out the rest of the details later. You know, I'm young, I exercise. Well, I'm not young, I'm 61 years old, but I exercise a lot, so I'm physiologically younger than my age. So anyways, I eat more fruits than that, and it's working out well for me. But McDougall say only eat 5% fruits, 5%. He's a lot of times dealing with older, sicker people. If you exercise a lot, there's a lot of good things about fruits, okay? They're low in protein. They're high in potassium. They're low in advanced glycation products. They're alkaline, okay? They taste good. Get your social life under some type of stability, you know. Maintain your social support system. Get your sleep. Religious people are a lot healthier. Get some sunshine when you can. Exercise. You know, be nice, and so you get along with people. The only thing I supplement is B12, methylcobalamin. Okay, now we're going to get back to some of these more disease mechanisms. I kind of forgot I had that slide in there. Okay, a high-fat meal leads to leaky gut and low-grade endotoxemia. So postprandial means to eat, so you get postprandial endotoxemia, and you get LPS in the blood, and it causes problem. High-fat meal causes leaky gut, LPS in blood, endotoxemia. That's bad, and that's inflammatory. That can activate neutrophils, causing all kinds of nonspecific inflammation. And the same risk factors for leaky gut are typical of the risk factors for becoming fat, obesity, hypertensive, and diabetes. It's basically the Western diet, okay? You know, the average Westerner by 60 years of age, they're fat, sick, and stupid, okay? I'm skinny, healthy, and strong, and smart. That's what you want to be when you're in your 60s, okay? I sometimes have some young guys make fun of me when we're lifting weights, and I always say to them, you know, when you're my age, you're going to be a fat cardiac patient, okay? Don't even kid yourself. All right, hormonal contraception, that's an example of estrogenics, and that can increase your risk of autoimmune disease. BPA can also have harmful effects. I'm talking more about estrogenics in a little bit. They can sort of be a little bit schizoaffective in terms of their effect on the immune system. They can increase or decrease certain parts of it. I would just avoid exogenous estrogenic chemicals. I'm going to come back to them in a moment. Here's just a paper about, you know, milk proteins being associated with demyelinating disease in the brain. Dairy is really bad. Dairy's got big associations with constipation, type 1 diabetes, multiple sclerosis. All the problems with dairy go on and on. It's much worse food than people realize. Okay, I'm just showing you one slide from Tetsumori Yamashima. Tetsumori Yamashima is a Japanese MD, PhD neuroscientist who was given the task of figuring out why are so many Japanese becoming demented when that didn't used to be the case. And he says because they've westernized their diet. They're eating a lot more fried food. And that's leading to the whole cascade of reactions through, you know, the PUFAs, polyunsaturated fatty acids undergoing lipid peroxidation, forming toxic aldehydes like hydroxynonenal, and that destroying brain cells, destroying pancreas cells, etc. And it can also lead to autoimmune disease. High-fat diets activate neutrophils. I'm going to abbreviate neutrophils NP sometimes, so you will see that. And they will, once they're activated, they release MPO granules, and the MPO myeloperoxidase, here it is, MPO, is used to make a bleach-like substance to kill bacteria, because when it binds, let's say, LPS, it thinks there's a bacterial invasion, okay, so it tries to kill the bacteria, okay, and there's other things that'll happen with, I forgot to show it, I don't have a slide in here, but you can also get netosis, where the neutrophil releases its DNA, and when it releases its DNA, that DNA becomes extracellular, and now the immune system has access to it. Because look at the autoantibodies in lupus, double-stranded DNA, ANCA, anti-nuclear antibody. That's because you've exposed nuclei, DNA, from your own cells that normally doesn't get access to the extracellular space because of netosis, for example. Anyways, neutrophil activated by fat releases MPO, myeloperoxidase. It's cationic, meaning positively charged. It interacts with the negatively charged glycocalyx, which is anionic because of all the sulfates, heparan sulfate, and the glycosaminoglycans, sialic acids at the end of the glycoproteins, and cholesterol sulfates. Anyways, they bind MPO and they collapse down. Once they collapse down, the glycoproteins of your glycocalyx. Now you expose adhesion molecules, things like VCAM, vascular cell adhesion molecule, and other ones, and you will now get binding of the neutrophils to the endothelium. That is bad. That is the beginning of worsening inflammation, okay? And there's other bad things that are going to happen. You don't want this, okay? This is another reason why I'm so against eating these high-fat diets, all right? And you get a cascade of additional reactions. You even start to cleave your core proteins, okay? And that's not good. So you really can lose your glycocalyx pretty fast. Eat healthy, and you can restore it pretty fast too. Okay, heparin, the medicine with an IN versus heparan sulfate on your glycocalyx, your glycosaminoglycans. It also has a negative charge, and it helps to disperse the myeloperoxidase, the positively charged myeloperoxidase. The way your blood works is all the good stuff tends to be negatively charged. Your endothelial glycocalyx, your red blood cells, your white blood cells, your albumin protein, they're all negatively charged, and they have a zeta potential, negative charge on them. Whereas bad things can be positively charged, like your LDL cholesterol, and that can, when it's present in high amounts, it'll overcome the zeta potential, start sticking red blood cells together. That's called blood sludge or rouleau formation, stack of coins in French, and that leads to thick blood, increased blood viscosity, and then you're pumping a milkshake through your body instead of water, so to speak, and the thick blood leads to hypertension. And then you vasoconstrict the system with dietary sodium, and all of a sudden you got high blood pressure. So avoid the excess dietary sodium, avoid the excess dietary fat, and you avoid that problem. Simple. It's not essential hypertension. That's just BS to sell drugs, okay? You know, in Lancet Journal, 1929, author's name was Donison, C.P. Donison, Lancet. There was 1,800 consecutive adult admissions to a hospital in Kenya. All these black patients in Kenya eating a plant-based diet. There was zero hypertension, not one. Yanomamo, same thing in South America, Amazon jungle between Venezuela and Brazil. They have no hypertension. They eat a plant-based diet without added salt. Okay, so I'm just telling you this thing to be healthy. So what happens is neutrophils start adhering to the endothelium, and they start releasing cytokine inflammatory chemicals, and you get this progressive inflammation. That's bad. You don't want that. High-fat diet causes elevated myeloperoxidase in the blood. You don't want that. So this is why you're going to hear me recommend a low-fat diet, because the more you study it, the worse it gets. When you eat a high-fat diet, you also get phosphatidylserine externalization. Phosphatidylserine is a phospholipid in the plasma membrane of red blood cells, for example, and other cells. And it normally should be primarily stored on the inner face of the plasma membrane. When you eat a high-fat diet, you start getting phosphatidylserine externalization where it flips into the outer layer. And that makes the red blood cells less deformable. That contributes to hypertension, okay? And when you get that, these cells, these red blood cells, will even bind to the receptors for advanced glycation end products, and that's prothrombotic, that's pro-inflammatory. It's all bad, okay? You don't want that. Okay, another thing too, we've talked about this before. This is largely the work of Etheresia Pretorius, a lady PhD from South Africa, and Douglas Kell, PhD guy from England. And what they talked about is when you got leaky gut, LPS and LTA, bacterial endotoxins, they get into the blood and they interact with fibrinogen, the blood clotting protein, and they change its structure from alpha helix like a slinky, cylindrical, into being flat like beta pleated sheets. And they stack up on each other. They form adherent aggregates, and they clot. And they form a bad refractory clot called dense matted deposits that are hard for the body to lyse. And these can go plugging up arteries in your heart and your brain, your Johnson, anywhere else. Not good. Okay, so that's amyloid clotting. Amyloid means like you change the secondary protein structure from being alpha helix to beta pleated sheet. That's what it means. Okay, excessive free iron can do the same thing through ferrous redox cycling and the generation of reactive oxygen species in the blood. So you don't want to be iron overload, which means you don't want to be eating like red meat full of iron. You don't want to be eating these processed foods which are routinely reinforced with iron. They're all bad. Okay, leaky gut and gums. Yeah, take good care of your mouth, because if you got leaky gums, that can also lead to bacterial endotoxins getting into your blood. You even have dormant bacteria in your blood. I'm not going to go into all the details on this. There's another paper by Douglas Kell and Etheresia Pretorius. So they're both brilliant, and they've written a lot of good papers. But the dormant bacteria in your blood are sitting around waiting for iron. They can be reactivated. I mean, bacteria spend their life waiting around for a good meal, and then they replicate like crazy, and they release toxins. You know, if a man's going to walk through the desert, let's say 100 miles, he can't do it by himself without water, because otherwise he'll die. He needs the water to live. Well, bacteria need iron to live. So if you deprive bacteria of iron, it's like depriving a human of water. They can't live. And that's why if you look at an egg white, imagine bacteria can get through the shell of an egg, and they want to get to the yolk to feast on it. But in the egg white, there's no protein. There's no iron. There's no iron in the egg white. And because there's no iron in the egg white, the bacteria can't get through there. And so the human body also sequesters iron to protect us from infections. But if you're iron overloaded and you got free iron in the blood, you're more prone to infections and inflammation. Like I said, men get iron overload in their 20s, women get iron overloaded when they're postmenopausal. This is part of the reason why women live longer, because they menstruate than men. That makes their blood less thick, less hypertension, and they also are less prone to being iron overload. Here's ferrous redox cycling, meaning that the iron, ferrous, cycles back and forth from Fe2 plus to Fe3 plus. It's a transitional metal, has a variable valence, and it can do that. And in so doing, it gives off electrons to things like hydrogen peroxide, and this is called the Fenton reaction. You can remember Fe for Fenton, Fe for iron, okay? And that'll produce hydroxyl radicals, initiating lipid peroxidation, reactive oxygen species, DNA damage, all kinds of damage, inflammatory stuff you don't want, and that can initiate autoimmune disease. Okay, we talked about microcirculatory dysfunction, cardiac syndrome, microvascular dysfunctions. So these are the little penetrating arteries of the heart muscle instead of the big epicardial hunk and branches. And other parts of the body too. You got big arteries and then you got little arteries. And what I'm saying is you can be messing up your little arteries with all these things like amyloid clotting. If you got elevated hemoglobin A1C, that contributes to causing hypoxia. Those red cells will release less ATP, and this is part of the vasodilation mechanism, and you'll get some vasoconstriction from that. Because as tissue takes on oxygen, the PO2 decreases. Hemoglobin and red blood cells release oxygen. The oxygen release causes hemoglobin to change its shape, and this causes the red blood cell to release some ATP into the blood. This ATP will normally cause increased nitric oxide formation and vasodilation. So the adjacent, because it's a signal that the tissue needs more blood, so it'll get more oxygen, so it'll get more. More blood flow brings more O2 to the tissue, and this is one of the mechanisms of coupling blood supply to tissue activity. And so what I'm saying is, when you have elevated hemoglobin A1C, you've distorted the structure of the hemoglobin in the red blood cells, and they're less able to have ATP released, meaning they're less able to induce vasodilation, meaning that the tissues don't get as much oxygen and glucose as they need. And this is all bad, okay? Tissues need their oxygen and glucose, so they don't function so well. Let's see. I'm not going to go into all these mechanisms. That's sort of more of the same thing about that ATP release stuff. High-fat diets, when you work with animal studies and rats, it cause brain fog. It's just pretty well known. You also slow down your brain cell function. Just another paper, high-fat diet, you decrease the memory of the mice, you decrease their mood. High-fat diets are bad for the brain. Okay, here it is. Feed a mouse a high-fat diet. In just one day, they'll have decreased memory. You can test it. It's pretty easy to objectively show in mice. Okay, diabetes is primarily a disease of excess dietary fat. There's a little more to it than that, but that's the money. Excess stress contributes to it, and there's a few other things as well. But excess fat in the muscle, postprandial hyperglycemia, excess fat in the liver, then you get even fasting hyperglycemia. And the fat just accumulates from spot to spot. Then it goes to the pancreas and damages the pancreas beta cells. You lose insulin production. You become insulin dependent. I got lectures on all this. Plus, I go through the papers of Michael Brownlee, the best paper ever written on diabetes, the unifying theory of diabetic complications. And I also go through the work of Gerald Shulman and Roy Taylor, and that's the stuff you need to know if you care about diabetes. Okay, I also go through the diabetes mechanism. The fat just pops across the plasma membrane of the skeletal muscle cells. There's nothing you could do about it. They inhibited all the fat transporters. It did not matter. It intercalates itself into the outer leaflet of the plasma membrane of the skeletal muscle cell, and then it's called the flip-flop maneuver. It flips into the inner leaflet, then to the cytoplasm. Then it overwhelms the mitochondria with too many electron carriers. Sat fat is the worst one because it's saturated. It produces more electron carriers when it undergoes beta oxidation than does, a MUFA or a PUFA. MUFA is monounsaturated fatty acid, PUFA is polyunsaturated fatty acid. So what I'm basically saying is there's nothing you could do other than eat less fat. That's why you don't want to, there's all these nonsense promoters on the internet, because imagine you're a big meat company or a big drug company or a processed food company. In order to sell your stuff, people to buy that junk, they have to think that it's good for them or okay for them. So they have to be tricked. Okay, that's just a fact. It's never going to change. So you don't want to be a chump. You can look up the paper right here. All right, over time, the diabetes causes thickening of the capillary basement membrane. The hypertension causes thickening of the vascular smooth muscle, for example. And the net result is, as you damage the arterial wall and you also stiffen your RBCs, you're going to have less delivery of oxygen to the tissues. Less delivery of oxygen to the tissues means hypoxia and tissue dysfunction and eventually damage, eventually irreversible damage. You don't want that. Food's got all the good stuff. Magnesium, for example, is right in the center of chlorophyll. You want your magnesium, and you do. It's very good for you. Most people are magnesium deficient. Eat your plant foods. It's in the center of chlorophyll. You want your potassium, P for plants, P for potassium. Plant foods are very high in potassium and low in sodium. And processed foods are the opposite. Okay. This is just a little diagram of where advanced glycations come from. Advanced glycation end products in diabetes. Basically, you inhibit this enzyme in glycolysis in the cytoplasm, glyceraldehyde 3-phosphate dehydrogenase. And now its substrate backs up glyceraldehyde 3-phosphate, undergoes a side reaction to make MgO, methyl glyoxylate, and then that just goes around glycating things in the extracellular matrix, inside the cell, in the blood, and then the AGEs, the glycated things, they just cause lots of reactive oxygen species. We're not going to go into details on that now, but it's bad. And then the other thing too is, I go to the grocery store and I wanted to take a quick look at the toothpaste, okay? And almost all of them had fluoride, and it made me sad because what it made me realize is that like 99% of the toothpaste had fluoride. So what that means is the American public is so stupid, it's so entirely clueless. It has been known that fluoride is a disaster and a poison since at least the sort of early 1980s. That's been widely known. And the fact that here we are, 40 years later, and 99% of the public doesn't know this, that's not good. One of the reasons why, the country's sort of descending into slavery, heading towards it, and, loss of free speech and all this crap is because the average person's a moron. They don't know anything, okay? Because the public schools make them stupid. All they do is memorize a list of vocabulary words and they forget everything. A typical person can't remember anything, myself included, from grade school or high school, other than how to type and driver's ed, okay? That's about it, because it's designed that way. It's designed to make you stupid. All right, so anyways, fluoride is a free radical, has an unpaired electron in its outer octet. It's super reactive. It's hyperreactive, okay? And you can basically look, it's a halogen in the vertical column of the periodic table of elements. All the halogens are bad. Fluoride, chloride, bromide, and iodine. Okay, I know we need a little iodine for thyroid hormone. I know it's normal to have some chloride in our bodies. That is true. But we get excessive amounts of it with chlorinated water. Now, why is the chlorine put in the water in excessive amounts? To sanitize it, to kill stuff, okay? F minus also kills bacteria. So anyways, these are things are bad. You don't need any F minus at all, okay? And then bromine's used to sanitize pools and bread sometimes and stuff, and it's also bad. You don't need any of that stuff. You'll get enough iodine eating a wide variety of plant foods, not even a wide variety. I don't want to talk about iodine right now. I've given entire lectures on that before. F minus also inhibits intermitochondrial membrane electron transport. It's bad. It's bad in numerous ways. It forms complexes with Al that enter the brain and cause brain cell damage and increases your risk of dementia, lowers the IQ of kids. Okay, here's an example of estrogenic chemicals. The basic backbone is like cholesterol. And then the hydroxyl group is polar, but it's unique in an estrogenic chemical of having a benzene ring here with 3 double bonds. I also call it an aromatic ring. They tend to smell nice. Okay, but the problem is this combination of the benzene ring with the hydroxyl group is a phenol, and they're great preservatives because they've got good long shelf life, and they're antimicrobial, and that's why they put them in tons of products, but you want to avoid them to the extent you can. And don't count on anybody to ever make things better for you because they're not going to. They can't. These are billion-dollar chemicals. And people say, oh, we're going to ban bisphenol A. Yeah, right. They just put a sulfate group in the middle, and you still got the phenol groups on both sides of it, so it's still estrogenic. So what I'm saying is forget about any institution saving you. You have to learn how to save yourself. The point of this slide is just that you want to eat dietary fiber because it keeps good gut bacteria in your colon. If you don't eat good dietary fiber, you lose the good gut bacteria, and then the bad gut bacteria, they will interact with the excreted estrogen. Normally, the liver excretes excessive estrogen into the gut, and you defecate it out of your body. But if you don't eat enough dietary fiber, then you get a lot of bad bacteria, and they will unconjugate the estrogen. It's conjugated by the liver to facilitate excretion by the body through defecation. When you unconjugate it, because the bad bacteria have more of an enzyme called glucuronidase, the estrogen gets reabsorbed into the body and the person becomes high in estrogens, predisposing them to increased risk of PMS, fibroids, cancer, and autoimmune disease. Okay, another thing here is VOC, is volatile organic chemicals. And these are things we talked about, things like paints, solvents, varnishes, waxes, toluene, formaldehyde, xylene, and benzene. Okay, they can be inhaled and induce oxidative stress, damage cells, and lead to autoimmune disease. So you want to avoid these things. You say, well, how can I avoid them? Well, for example, formaldehyde. You look at most men's dress shirts, I would say 90% of men's dress shirts, they've got like formaldehyde in them. They're anti-ironing, okay? What do you think those anti-ironing chemicals are to stiffen the shirt? A lot of times they're formaldehyde. You don't want that, okay? Get old-fashioned cotton shirt, for example. You don't want to be going to a dry cleaner. They use a lot of really toxic chemicals. You don't want to be smelling paint. You don't want to be smelling liquid paper. None of that crap. Okay, so I'm just reminding you, VOCs can contribute to autoimmune disease. Okay, here's examples of VOCs from that paper, contributing to ulcerative colitis, alopecia, lupus, graves, rheumatoid arthritis, etc. Okay, now here's where I sort of meant to put my Spartan vegan side. Just be simple. Eat starches to satisfy your hunger, which just means a plant food that is basically a polymer of glucose wrapped in fiber. Potatoes, sweet potatoes, rice, beans, oatmeal, quinoa, and wheat if you're not gluten sensitive. All those grains, wheat, barley, rye, all that stuff if you're not sensitive to it. Some people are. One of the things I don't like that much about pasta is if they compress it with a machine into a specific shape, sometimes that adds, I think, cadmium to it. Lead Safe Mama talked a lot about that. Pasta, in terms of taste, it tastes good if you mix it with beans. That's my pasta sauce. I'll rub some beans on there. Okay, fruits, berries, bananas, oranges, and other fruits. If you have a problem with your thyroid, watch out for the cruciferous though, because they're goitrogenic. Watch out for soy. It's also goitrogenic, meaning that they impair thyroid function. But this is simple. This is all you eat. Single ingredient, starches, fruits, and veggies. That's it. That's all you eat. If you want to get fancy and use spices and all that, go ahead, but you don't have to. And then you say, well, I don't know how to cook. All you have to do is boil water to eat all the starches. And the starches are the best way to satisfy your hunger. You have to satisfy your hunger when you change your diet. By the way, If you are taking pills for diabetes, for hypertension, or for anticoagulation, blood thinners, you need to let your doctor or health care provider know so you can titrate your dosages down. Because when you change your diet, a lot of times you're going to dramatically reduce your dosage of those other things. And you don't want to overtreat your hypertension, or you could pass out. You don't want to overtreat your diabetes. You could be hypoglycemic and pass out. Very bad thing. Okay, so anyways, that's a simple diet. I only got like 1 or 2 more slides more. And yeah, here it is. Be like Adam and Eve. Keep your indoor heating and plumbing. But other than that, remember what God said in Genesis 1:29. Behold, I have given you every plant yielding seed, which is upon the face of all the earth, and every tree which has fruit. It shall be food for you. There it is. What more do you want? Remember also, what God said in Genesis 1:27. Man is created in the image of God. And he also said in Revelations, beware of pharmakeia, pharmacology, sorcery. So anyways, those are the things in this lecture. And the first slide kind of summarized it as well. That's a rational approach to preventing autoimmune disease, and hopefully that'll help you.